Your teenage child has been diagnosed with functional neurological disorder, short for FND. Does your teen also have EDS, Ehlers-Danlos Syndrome, or hypermobility spectrum disorder? If so, what do you do and how are they even related? And what can you do when your teen has both FND and EDS? Let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy. In this video, I'm going to talk about what is FND and what is EDS, and then how are these two things related? I mean, even are they connected? And what can you do if your teen has both FND and EDS? So without further ado, let's go. So first of all, what is FND? For those who don't know me, welcome, and this is what I do. Teen, FND, and chronic pain are my specialty. Working with teens are my jam. And I actually have a lot of families who contact me with this question and concerns. Well, my child has been diagnosed with FND, but she also has ADS or hypermobility spectrum disorder. And she also has POTS, postural orthostatic tachycardia syndrome, or dysautonomia. We don't know what to do. This is so overwhelming. We don't know where to begin and what to focus. What is the priority here? FND, EDS, POTS, dysautonomia, or what? So let me walk you through one by one, because that is a very, very common question I would get, and it's actually common things, more so than you would imagine. First of all, what is FND? Let's start from the beginning. FND is an umbrella term to describe this cross-wired problem between the brain and body, even though your child's brain and body are physiologically and structurally intact and A-OK. It is a real diagnosis. Your child's not making things up, and it is a biopsychosocial phenomenon. It is not just one thing, or trauma or stress or anxiety, all psychological. It's all in your head. Yes, there could be that, but it's not just that. So if your teenage child's doctor is still insisting that this is just one of this, it's got to be trauma, it's anxiety or psychological, whatever, I would say thank you, but no thank you. What that means is this doctor, whoever told you, is so outdated. It's almost equivalent to this doctor saying that, yes, the fastest internet is dial-up kind of thing, So it is very, very old understanding of what this FND is, which is pure mental health disorder or all coming from stress and psychological factors, all right? This is biopsychosocial phenomenon. So what is EDS? Ehlers-Danlos Syndrome is a genetic disorder. It's actually a connective tissue disorder that you're kind of sort of born with. And typical scenario is that your teen is very hypermobile. And if that child is not quite meeting the criteria for EDS, then your child probably got this diagnosis of hypermobility spectrum disorder. Kind of like FND, hypermobility spectrum disorder is an umbrella term to describe this connective tissue disorder, and EDS is one of them. Kind of like a non-epileptic seizure is a type of FND kind of thing. So anyway, so EDS, hypermobility or hypermobility EDS, what comes with it is that not only it's a genetic and connective tissue disorder, it comes with a lot of joint pain, fatigue, recurrent injury that includes frequent dislocation of the joint, and guess what? Dysautonomia or feeling super dizzy. And again, dysautonomia is an umbrella term to describe dysfunction of autonomic nervous system, and one of which is POTS, postural orthostatic tachycardia syndrome. And so your child gets super lightheaded and dizzy and then faint when either postural, so when the posture has changed, or feeling that way kind of persistently. So hypermobility and dysautonomia often coexist, and therefore FND is also kind of thought of as a somewhat similar in that vicinity. And so back to the hypermobility EDS, the other things that you might be seeing are also GI issues, so somewhat of an IBS, kind of thing, that the digestive system is not quite working. So a lot of diarrhea or constipation. And also there are some psychiatric comorbidities such as anxiety and depression, things like that. Not because somebody has an anxiety or depression doesn't necessarily mean, oh, this person also has hypermobility or the other way around, but people who do have this diagnosis of EDS or hypermobility spectrum disorder typically has these things that kind of come with it, all right? So I want to talk about this study that's done by some researchers recently, technically earlier this year in 2024. And so what they have done was they looked at their chart and patients who had EDS. So usually EDS, where do they live in the hospital or medical system is rheumatology. And so what they have looked at was a chart of the patients who did have an EDS and whether they also had FND or symptoms that resembles functional neurological disorder. And the caveat here is, once again, most of the research studies are done on adults, so it may or may not directly correlate with teens. However, it's some data. In my mind, some information is better than nothing, but bear with me. So they collected 24 patients, not a huge, but some. Okay, so out of the 24 patients that they looked at who had EDS, coincidentally, most of them were women. But out of 24, guess what? 22 out of 24, so the majority of the people presented with at least one or more of the functional neurological symptoms, either motor or sensory symptoms within the FND category. Now, these people didn't necessarily have the diagnosis of FND, but when they looked at complaints and what they were experiencing and things like that, they certainly resembled symptoms of FND. So 22 out of 24. So how bad is it or how much is it? Well, guess what? They compared with the healthy control. So the people who didn't have any EDS, well, first of all, when they looked at that information, nobody had any motor symptoms related to FND. And only 2 had a sensory symptoms of FND. And once again, they didn't necessarily have the diagnosis of FND, but 22 out of 24, and then practically a 0 compared to people who didn't have the EDS diagnosis. That's a huge deal, right? And of course, my next question was, why? How are they related? Guess what? They didn't know why. They just looked at the chart and then, oh, guess what? There's a lot of similarities and then there's a lot of overlaps. That was about it. They don't know exactly why, but logically speaking, what they're saying was, okay, based on this information, so anyone who has EDS gotta be checked for FND as well. I'm like, okay, that's the right direction, at least going in the right direction, right? And so I like that. But here's the deal. Regardless of the why, currently speaking, the treatment of EDS includes, well, first of all, there's no cure for EDS because it's considered genetic and a connective tissue disorder. But what you can do is to have a pretty decent life. You can do PT, OT, psych support, or some like psychological support, counseling and therapy and things like that. And then some medication treatment and some surgery if needed. But not everybody with ADS will be needing medication or surgery. But the most common recommendations for EDS treatment is PT, OT, and counseling. And now, how is FND and EDS, are they twined other than this information? Well, first of all, what I noticed was that there's a lot of overlaps. And actually, a lot of the teens that I work with, they also, well, first of all, there is a high percentage, I haven't run the number actually, but there's a high percentage of dancers and gymnasts in my private practice and also in my online program, Teen FND Academy, who is struggling with FND and chronic pain. They also are very flexible. And then sometimes they think that this is their talent. Like I had a couple of teens telling me, I have a great contortion and this is my talent. And I'm like, great. I'm thinking, is that actually hypermobility? Right? Not that I need to pathologize everybody or whatnot. That's not my intention. However, there is a pretty good, anecdotal, like in my personal experience of kind of high number of dancers, hypermobility, potentially EDS and FND, and then they also get POTS, or dysautonomia, and then getting super dizzy and then fainting and stuff like that, and the chronic pain of all the things. So they've got a lot going on, and then lots of overlaps. And nobody really knows exactly what the mechanism or the clinical reasons why FND and EDS coexist a lot. We don't know that, but what we do know is that with FND at least, there is a lot of, again, connection, the brain and body communication problems, right? So then there's a lot of like brain dysfunction going on. And so maybe there is some relation there. Again, at the time of this recording, nobody really has a clear answer to it. What we do know is that there are some overlaps. And guess what? PT, OT, psych support are also pretty commonly recommended treatment for FND as well. They're not exactly doing the same thing per se, in my opinion. However, here's what I can say. First of all, EDS is a genetic disorder. However, FND is not. FND is not a genetic disorder. So your child is not born with FND, just so you know. And people with EDS, as I mentioned, can have a pretty decent life with strengthening their muscle, and so that they're strengthening and supporting the joints and things like that. But here's a kicker. Teens with FND, as long as they're taking the right approach, that they can resolve FND completely. Like they can be done. They can get rid of FND completely once and for all. So if they happen to have both FND and EDS, and maybe with dysautonomia/POTS, then instead of dealing with all three things, they can be done with FND, and then guess what? They can also have a really good life with just one or two issues, as long as they're also managing these symptoms. I had a lot of experience with teens who have struggled with FND and EDS and POTS, and when I worked with them on FND, guess what? Their POTS got better, and EDS was very, very into a minimum level. So it didn't even bother them. It did not stop their life. And so that's absolutely a possibility. So parents, if you're bombarded with all of these 3-letter, 4-letter diagnoses for your teen, take a breather, first of all, and really starting to know more about these diagnoses yourself, right? So educate yourself. And there's so many misinformation out there. And so I would recommend that you start with this channel and then get to know about FND really good. And then ask your rheumatology about a reliable resource for that particular diagnosis of either EDS or hypermobility spectrum disorder. But other than that, just because your teen has FND and EDS doesn't necessarily mean that FND cannot be treated. I have done so many of these experiences with tons and tons of teens who had multiple conditions, including FND, and still got better. And so in my mind, think about what is debilitating on a day-to-day basis. Again, fatigue, pain, there are a lot of comorbid kind of jumble mumble, things going on with overlaps. So it's not your job to figure out, oh, this pain must be related to FND, or this pain must be related to that, kind of thing. But what are the symptoms, including pain, that is really interfering with your teen's day-to-day activity level? Start there. Let's just say if your teen is very concerned or struggling with constantly fainting or passing out or having this non-epileptic seizure events or episodes, and or having this constant pain, then I would say start with FND and or pain specialist. And when I say pain specialist, I'm specifically talking about pain psychologists, because there isn't any medication or surgery that can resolve or get rid of chronic pain. And I'm not talking about acute pain that is coming from an acute injury. I'm talking about chronic pain. So start there, list out what are the symptoms that are happening, and then of those, what are the most annoying or frustrating symptoms that your child is struggling with. And this might be something that you have to talk to your teen about, what bothers them, right? Instead of what you think is bothering them. Okay. And then the infamous last sentence, make sure that you work with FND specialists. Now, I have asked by so many parents, well, what about working with a therapist? Because that's what we were recommended by this doctor who diagnosed our child with FND. Well, if the therapist, whatever the therapist, whether it's a physical therapist, occupational therapist, or psychotherapist, whoever you're going to be working with, if they're FND specialists, then yes, absolutely, you hit the jackpot. Absolutely work with them. But if they don't know what FND is or they're not familiar with that treatment, then why? Why are you seeing a non-specialist who can't really help your child or you for that matter? So really start working on finding an FND specialist. And as long as your teen age child is willing to engage with any provider that he or she is going to be working with, then when it comes to FND, it kind of doesn't really matter whether it's in person or telehealth. Again, as long as your teen is able to engage. And this is not the same thing as, well, my child does not engage with that therapist for counseling, and then it's actually good to do that in person. Well, unless you're an FND specialist yourself, FND treatment, again, can be done by either in person or telehealth. If the symptom is so severe that requires inpatient stay or intensive outpatient program, that's one thing. But guess what? Even if you're done with the intensive outpatient program or inpatient program, once your child is done with those programs, you kind of have to find the outpatient provider anyway. So start somewhere, whether it's an in-person or telehealth, as long as you can identify an FND specialist that can work with your teen, then that is a good place to start. And I do have a list of those people that I'm talking about. The link is down below. You don't have to work with me personally. I would be happy to chat with you whether you would qualify for my program or not. But the important thing is that you start looking at the right place. And so the list is down below. And you don't need to sign in for anything. You just click and then boom, literally go through the list and start calling them. Okay? That is the place to start. Again, leave me a comment whether your teen has been diagnosed or has been concerned about EDS or hypermobility spectrum disorder on top of FND, because I want to know. I want to engage with you so I can help you better. Thank you so much for watching this video, and I will see you in the next video.